Hello, this is Dr. Sam Dubé. Once again, I am an academic physician, applied mathematician, and strength coach, active in industry and education. And this is the third of our group interviews, giving a platform and a forum for physicians and researchers to express their views. Today, I'm joined by esteemed colleagues from Great Britain. It is wonderful to have them here with us today. We have with us retired orthopedic surgeon John Fairclough. We have consultant surgeon Anthony Hinton, and of course, we have physician and researcher Dr. Teresa Tess Laurie, who is the director of the Evidence-Based Medicine Consultancy, and in my humble opinion, one of the best evidence synthesizers in the world. So thank you so much, ladies and gentlemen, for joining us today. How I would like to run this is I would like each of you to introduce yourselves with a little more depth and then to present your views. So our experts today do have some very urgent and important messages for you, our viewers, to hear. It is currently July 28th, 2021, the date of this recording. So thank you. So John, would you please tell us a bit more about your background and present to us your views?
Yes, hi, I'm Professor John Feickler. I'm from Cardiff in Wales, part of the United Kingdom. I started off in life as a surgeon in the very early days, but I had a career which actually began in the jungles of Papua New Guinea. As a young doctor, I worked with individuals who were in the very beginnings of development. We had tuberculosis, we had malaria, we had leprosy. I had a young son born out there. I vaccinated him at birth. We gave him anti-malarials at birth. So we had a history of knowing that we had to protect our children from certain diseases. Now, why am I here today? Well, the thing is, all of you who are watching will have got the situation of being aware that there's a disease in this world. But 3 years ago, you wouldn't have known anything about it. Where did you get your information? You got your information mainly from the media. Sometimes some of you may have read scientific papers. Like many of my colleagues here today, I have read those scientific papers. And my concern is specifically in relation to the vaccination of children. Because when we vaccinate people, what we're doing is looking at whether or not the intervention we're giving that child is actually going to be a benefit to it or potentially at harm. And it's my background that I feel gives me some insight after all these years into knowledge, not specifically, but generally about risk and benefit.
Wonderful, John. Thank you. Tony, could you give us a bit more about your background and views?
Yeah, I'm a consultant ENT surgeon working in London. I worked in the NHS for well over 30 years. My concerns as well relate to particularly the COVID vaccine in children. Now, I've taken the COVID vaccine. I've taken 2 Pfizer doses. I'm not anti-vaccine. My 3 children have all had all of their childhood vaccinations, including MMR, polio, and all the rest, right up to HPV vaccine. But whenever we do a medical intervention on somebody, whether it's an operation, a drug treatment, a vaccination, you always have to weigh up the risks and the benefits in each individual. And when we look at the current vaccines for COVID, if you take a very elderly person, a person with lots of comorbidities, well, it may well be justified that for those patients, their risks from COVID outweigh the risks of the vaccination. And the elderly are going to have a limited lifespan compared to a young child. So for any possible unknown long-term effects, that's not such a concern if you're in your 80s. But if you're a teenager and you've perhaps got 80 years to live, well, those things become more important to take into consideration. And as we go down the age range, and particularly once we get into teens and below, I would say the evidence increasingly shows that the risks of the vaccine outweigh the benefits to those children, because they're really not at any undue risk from COVID.
Thank you very much, Tony. And Tess, could you please give us a little more about your background and your concerns and an overview of your views?
Thank you. Yes. Well, at my company, we do what's called evidence synthesis, which is preparing bodies of evidence for guideline teams at the World Health Organization, for example, to evaluate and then make a recommendation on whether or not to use a particular treatment. And we have no conflicts of interest, which is why our work is highly valued, and we do no work for industry. So we only do work for nonprofit groups. And with regard to vaccination, I'm certainly not anti-vaccination in general. I'm fully vaccinated. My children are all fully vaccinated. But with regard to vaccinating my children with the COVID-19 vaccines, I have reservations. My children are teenagers, and they have been receiving messages on their phones via the government app calling them in for vaccination. And my concern is that I haven't really been able to have a good discussion with them about this, because they're getting a lot of pressure from the government and also from social media to go for this vaccination. And it's quite clear to me, after having looked at the World Health Organization database of adverse events related to the COVID vaccines, I can see that there are more side effects associated with these vaccines than with other vaccines that have preceded these. So, for example, the tetanus vaccine, which is a very widely used vaccine, has been around since the 1960s and has been given billions and billions of times. And it has 36 deaths recorded against it in all these years on the WHO database. Whereas with the COVID vaccines, there's now about 8,000 or so just in the last few months. So that's a concern to me. And with regard to children, just knowing that they don't have a risk really of dying from COVID is very, very low, and getting bad COVID. They actually, most of them probably already have a good, they probably have antibodies to COVID already. So we really don't need to vaccinate children at this point, especially since the vaccines are still under clinical trials. So the clinical trials are not finished in adults. So it seems we don't need to rush into vaccinating children. The other thing is, I think, that many people don't know, many parents don't know, is that there are actually safe treatments for COVID. So people don't need to worry that if their child gets sick, there's nothing that they can do to help them. There are a number of doctors around the world, experts, who have put together treatment protocols and are treating people very successfully when they get COVID. So ivermectin is one of these treatments. It's a very old, safe medicine, costs very little. And I'm part of a group called the British Ivermectin Recommendation Development Group that is trying to get ivermectin approved and widely used throughout the world, so that doctors have the tools in their toolkit to be able to treat people appropriately if they do get COVID. So I think parents need to be aware that if their child does get sick, there are actually useful treatments, some over-the-counter treatments too, vitamin D and C, supplements that are helpful. And then the other thing is, just in terms of being a parent or being a doctor, first we do no harm. So we do no harm. As a doctor, I've taken a Hippocratic oath to do no harm, and my whole life is dedicated to saving lives and preventing suffering. So that's on a medical level. But I know most parents also they really intend to do no harm to their children. All they want to do is do the right thing for their children. So with regard to the COVID vaccines, I would just say, just hang off a bit. Don't rush into it. Wait for the longer term safety data, because we don't know. For example, we have no idea. There is no data. There are no data on what the effect on fertility is with these vaccinations. And, I would hate to vaccinate my daughter who's 17 and then find out in 10 years' time, actually, that vaccination impacted her fertility because, it concentrated in the ovaries or something. So we really need these data. We don't have them, and your child is not at risk.
Thank you, Tess. What I would like to do is basically open up the floor right now. And there's a few issues that we have talked about briefly together. One of them is the idea of informed consent. And here in Canada, in Toronto in particular, it's well documented that health authorities were using ice cream to entice children to be vaccinated without necessarily getting permission from their parents. So I wanted to touch on that issue. Would anyone like to address that? And more specifically, maybe what's happening in Britain right now? John?
I certainly address it's John here, certainly address the legal issue of consent in the UK. I believe the jurisprudence in Canada is very similar because it's based on similar law basis. The situation in our country is that we have a system whereby once you've reached maturity, you can make your own decision. A doctor has an obligation to actually not only give you the information, but there's a ruling called the Montgomery ruling, which means that you must understand that information. So there is a duty on behalf of the individual giving that treatment. Now remember, at vaccination centre, this is often just a trained vaccinator. They may or may not have that knowledge base. So if you are 16 above, you can give the consent if you are informed fully. However, the situation if you're under 16 is different. Under 16, you've got the legal consent be given by a parent or guardian. There are certain differences. We have a ruling in this country about contraception called the Gillick ruling, where you don't have to go to your parents. You can actually do that. Whether or not this will apply, if it's tested legally, I don't know. However, the reality of it is this. If you get a child between 12 and 16, they stand a risk of getting COVID. They have a minimal risk of having an adverse reaction to COVID. There will be one person in the world who will die. There may be more who die of COVID. There will be people who get very ill from it. That's a chance. There are also individuals who will die from a vaccine. I've seen people have anaphylactic responses from vaccines. There are also other responses which has already been alluded to by Tess. They're not terribly well documented, but there will be an adverse reaction. Now, what as a parent, as any parent watching, you've got to think, if you've got a 16-year-old child and below, they stand a chance of getting it in the general population, and they may have an adverse effect. That's COVID. If you give a vaccine, it is you who are actually giving the thing that they may well be harmed by. If that is something which you can live with, fine. But I actually believe that where there is a risk of an adverse effect, as a parent, it's a very, very difficult thing to say that if your child then goes on to develop a problem, it was worth it because you were trying to benefit someone like me as a grandfather, saving grandfather, or saving the rest of society. They didn't have the option. I think we should give them the choice. And that at the moment is there isn't the information.
Thank you. Tony or Tess?
Well, when I went for my COVID vaccinations, there were two things actually. The first is that there wasn't really any consent. There was no explanation. I was asked if I had any previous allergies, and that was it. And then it went in. And on the same day, in fact, a nurse that worked at one of the hospitals that I work at, she'd already had COVID, and she was also having her first dose of the Pfizer vaccine. And about 10 minutes after she had it, she had a severe anaphylactic reaction. Luckily, she had not left the hospital. So she was admitted and had steroids and adrenaline and an IV drip and was kept in overnight. And she now is unable to, she's been advised not to have a second dose, not only of that Pfizer vaccine, but she's been advised not to have any COVID vaccine second dose. And her current issue is that she, of course, wants to get her vaccine passport. And there is supposed to be a mechanism whereby if you cannot complete your vaccination because of a medical problem, you can still get your vaccine passport. But so far, she's finding it impossible to do that. So she was extremely lucky. 10 minutes later, she would have been in a car driving home on her own, and goodness knows what would have happened.
Tess, do you have a comment?
Yeah, I think, aside from the acute issues that Tony's described, because certainly they are represented on the databases, we are seeing those kinds of severe immediate reactions or blood clots and that within 24 hours, 48 hours. I think what we're all realizing as health practitioners, but also the public, that these vaccines don't seem to work that well, in the sense that people are still getting COVID. They're still getting long COVID. They're getting some people get a kind of long COVID-like syndrome after vaccination. And we as doctors are now giving that a name. We've actually been discussing internationally what to call the syndromes, and it looks like it's going to be called the COVID vaccine syndrome or something like that, spike protein syndrome. We're still in the discussions, because we need to be able to put a name to it so that we can treat it, recognize it and treat it. And to a large degree, this resembles long COVID. So, there's just, as I say, so many uncertainties. The vaccines do not seem to be working as well as we thought. They don't seem to work against variants. People are still getting COVID and getting long COVID. So there's really no reason to rush into giving vaccinations for children, because likelihood is they're still going to need early treatment if they get COVID. So they're still going to need ivermectin and other early treatments in combination if they get COVID. There's no need to vaccinate them without long-term safety data.
And yet this is not the message that's being promoted and propagated by public health authorities and government, is it?
No, in actual fact, one of our ministers came out recently saying that, children really, teenagers need to get vaccinated, and, university students need to get vaccinated to go back to university. So they're under enormous pressure. I feel so sorry for children in general, and I feel sorry for my children. I see, it really is, it's so confusing. And, and it really affects mental health as well. I think children are feeling really down. They don't know what to do, and they're not getting great guidance from their parents because their parents don't know what to do, and they're not getting great guidance from their doctors. Everyone just, the doctors and the politicians and everyone's just saying, you've got to do this thing. And it's increasingly, it seems like they have to do it just to go to a nightclub or just to do their university, or, you know, and it's really not fair. It's really not fair because they're not given the information, and in actual fact, because we don't know what the extent of the side effects are yet. You know, we don't have those safety data. They really shouldn't be pressured, and in actual fact, they should be encouraged to wait until there's more safety data, and we have a few years of safety data before they take this, fairly experimental vaccine.
I think, Tess, you raise an interesting point there. And again, many of the viewers will be in a situation whereby they say, well, what are these four doing here? I mean, I've heard it on different scientists. We've heard it in Britain, we have a thing called SAGE, means wisdom. These are surely the pick of the cream of the world. They know what they're talking about. How can you four be different? Well, I think that the one thing is that we have to look back. A year ago or 2 years ago, there were no papers on COVID. There are 160,000 now. Now, there isn't a long-term follow-up in 160,000 papers, so people have been churning out publications. The people who are in power, that's the people who control your lives, in general, do not have a scientific background. Our leader, our ministers of health, in both my local devolved country, Wales, or in the UK, don't have a history in science. One of the difficulties anyone has is reading a scientific paper. We work on a principle called probability. It's not truth and false. It's the likelihood that something can be right or wrong. And as Tess said, we don't have the information. So when you don't have the information, no one, whether on the Royal Society or whether there's someone who's working in an activity down the road, has any surety about what's going to happen. The most important thing is we don't do any harm, and that's the primum non nocere statement. And no one can say to a scientist, can you say that if I put this injection into this 12-year-old's arm, that they have 100% certainty of not dying? Because they can't give you that certainty. They also can't give you the certainty that 100% of them will survive with COVID. But it is the discussion which is missing in this. And the problem is you're being presented as a world with absolutes, whether it be mask wearing, social distancing, vaccination in children. And it's the vaccination in children which is the one that we as adults have a responsible for, because these children do not have a voice. And that is why I feel so strongly, is that I want to give my grandchildren the voice, which is, I don't want to do you any harm. If I thought it was going to do you any good, like I did with my son at birth, gave him TB injection at birth, I would do it, but not this. I think it's a step too far at the moment.
Tony, Tess?
I think there is some good news from the UK. Somebody commented that what would people say? It's just you three that are telling us this. But actually, in the UK, we've got the Joint Committee on Vaccination and Immunisation, which is about 20 or more scientists and doctors that advise the government specifically on vaccines and immunisation. No other medical matters, just that. And they looked at the evidence for vaccinating children for months and months. And they were obviously under a lot of political pressure to give the go-ahead for children and teenagers to be vaccinated. And the decision, or the announcement at least, was delayed and delayed and delayed. And it was delayed because the government knew they weren't going to get the answer that they wanted. So despite all the pressure, the advice from the JCVI was that in general, children below 18 should not be vaccinated yet. apart from some very specific, very small groups, while we await further safety data. And they felt that the risks of COVID to that group of children were so small that the risks of the vaccine could possibly be greater. So it's not just a few individual doctors that are very concerned about this. You know, we're all parents and we all have that emotional need to protect our own children and our own grandchildren. We're all doctors and we all want to protect all children. And it's often the least well off, the most deprived children at the bottom of the pile that end up the worst off in these situations.
Yes, if I could just jump in there and say, you know, the one thing that's really distressed me is the fact that the children who are immunocompromised and those children who are perhaps autistic or, you know, have some health limitations have been the ones that have been recommended to be put first in line in terms of receiving a vaccination as a child, which seems incongruous to me because they are the most vulnerable in society, particularly the immunocompromised. Because in the context of this new vaccination, it seems like there's a possibility that in actual fact, the vaccines may suppress immunity in some people. On the databases, we're seeing reactivation of latent viruses like herpes and shingles and so on in adults. So these suggest that the vaccines may suppress the immune system. And we don't have those full data in adults. So we really shouldn't be putting the most vulnerable children, those immunocompromised with autoimmune diseases and even those unable to maybe make health decisions for themselves and are in care homes, like, you know, we should not be putting them first in line. Those are the ones, you know, we need to be protecting all children, but especially those vulnerable children who already have health conditions and shouldn't be put at any risk whatsoever, you know, with a new vaccine that's not fully tested for safety.
Well, you also think, sorry, Tony, don't you also think that the situation we're getting given in the press is that the vaccine sterilizes, that somehow or other, once we've had the vaccine, that this child is going to be safe? And yet we know that there's just as much chance as them dying of seasonal flu this year.
Yeah, well, we only have to look at what's recently happened with the health secretary who had COVID, had 2 jabs, had his COVID passport, but then was in contact with the Prime Minister and the Chancellor, who then both had to self-isolate. So it's never been claimed, has it, that the vaccine stopped you catching COVID or stopped you transmitting COVID? So where on earth is there any medical logic for any sort of COVID passport? There's no medical reason for a COVID passport. I suspect at the moment, a lot of this talk of COVID passports to go into football matches and nightclubs and going on holidays is to sort of, I suppose to put it bluntly, it's to blackmail young people into having the COVID passport, into having the vaccine. But I think the one thing we can say about young people and children is they've got time to wait. They're not at great risk. And why not wait? You can't unhave the vaccine. You can have it later if it becomes obvious that it actually is necessary and things change. But once you've taken it, you can't untake it.
I think a good point is that transmissibility as well, because there's no evidence to show that the vaccines reduce transmission of the virus, you know. So the children are being sort of blackmailed into taking the vaccine so that they can protect their grandparents. But if they're still going to be transmitting it, then they're not going to, it's really, it doesn't work. So that's not a good reason to persuade your child to take a vaccination. It's not going to, they're taking it is not going to protect grandparents.
And Tess, where in history has there been a precedent to give children something to protect adults?
It just doesn't make sense.
My parents said to me, they do not want their grandchildren subjected to anything in order to protect them. The vaccine was available to them, which they took, and they've done everything they can to protect themselves. They're in their 80s, and they would put their life on the line to protect their grandchildren. It's not the other way around.
What are some, sorry, Tess, go aheed.
I was going to say on the subject of transmissibility as well, is that what people don't know and what many parents don't know is that ivermectin reduces your transmissibility. So we need treatments for COVID, and that's something the government is not sharing, that there are treatments for COVID if you get sick. And if you take ivermectin, you reduce the length of time that you carry that virus. So you transmit for a shorter period. So medicines, ivermectin and others, will reduce your transmission and will treat you and will treat your children. And so you really, and these treatments are safe and old. They've been around for ages. We don't have safety concerns about them. They're used in children. So ivermectin is used in children widely around the world for parasites. So, I think if it's really important at this stage for parents to access trustworthy information on ivermectin and on alternatives to vaccines. And as a matter of fact, that includes taking responsibility for your children's health, because I think many of us have kind of outsourced our children's health to the government because we're working, we're busy, and we leave our children to be educated by the government. We leave them to be, to get all their health checks and whatever. And I think now we've got to take back that responsibility and say, thanks, but no thanks. Now we want to make sure our children get enough sunshine, they get enough exercise, they eat healthy food, no takeaways and junk, no sugar, nice organic leafy vegetables, and out in nature, away from the screens, because I think that our children are so, they're so attached to their phones and TVs, and I think probably we all are too. So I think we need to reevaluate what a healthy lifestyle is and actually take responsibility for that for ourselves and for our family. Because no vaccine is going to fix their mental health, our children's mental health, with all that's happened, and treat you if you get sick because your immune system's run down. We really have to take responsibility for that now and protect our children.
So one of the things that really was detrimental to children were the lockdowns, correct? And you're alluding to this, and mental and physical health, because you want to talk about gimping immune systems and not letting children go out and be children and expose their immune system to pathogens, and with each other, is allowing them to be exposed to all this. It will boost their immune system. This is the way their immune system was designed to function. So this in itself, it opens up a whole new can of worms. What was done in terms of trying to isolate people and isolate healthy people from the vulnerable people, right? We had this great Barrington Declaration that kind of went by without a peep, and it's very unfortunate. So I'm sorry, John, you had something to say.
Well, really, almost the same point as you, but Tess raised the issue there in terms of what's happened to these children. What we've done is the word fear, and we frighten our children. How could we ever say to a child, you're a weapon? Because that's what governments throughout the world have said. Don't hug granny, you can kill granny. In other words, you're a weapon. Within the first few weeks after the original lockdown, my youngest grandson was running away because he didn't want to kill me. That was what the government had told him, that if he went near me, he would kill me. Now that is actually universal, and some of your listeners will still be in the situation they're worried. Now, the problem is that the children are very vulnerable. Their mental development, their physiological development is something you can't readjust. What they get by the time they're actually maturing is what they've sown when they're younger. If we lock them up, they get the fear factor. As Tess said, if you keep them indoors, you reduce the amount of vitamin D. One of the big problems you see is that, for example, I think it was in Canada, and it's one of the countries, which is where they were offering a beef burger as incentive to have a vaccine. Well, one of the things we know is that, in fact, obesity actually causes problems. And that's quite often because when you've got a big tummy, you can't ventilate properly. And so there are issues around COVID which have been uncovered, and you cannot actually just isolate and say, this one condition will determine whether your child lives or dies. But what we can say is there's something that we're actually actively doing, which is looking at one particular part, which is a vaccination. In really remote circumstances, it may be in 1 or 2 people, it would have saved that child. But for the vast majority of people, it will have an adverse effect compared with what COVID would have been, or it has an equivalent effect. But as long as we're in a situation whereby we are pretending that in any way we can make our children less of a problem by giving them a vaccine, we're mistaken.
So all governments throughout this have brought in lots of various measures, never tried before. In fact, if you go back to the UK's original pandemic plan, none of this was in that. That was quite a sensible plan. But things like lockdowns, for instance, as we said, locking our kids away so they get no sunlight, they don't mix with other people. And what have we got now as things open up? We've got increasing numbers of young children going into hospital, not because of COVID, because of other respiratory viruses, because they haven't been doing their general mixing and contact with other children and keeping their immune system working during that time. And I don't think there's a government anywhere that has done proper analysis of the harms of the measures they instituted against any possible benefits. Something that we have to do every day as doctors when we're recommending a treatment to a patient. We could never do that with a new treatment to a patient without having the harms and the benefits properly weighed up. And yet that's what governments all around the world have done, and just threw out a perfectly good plan that was prepared over 20 years.
Tess, can I ask you a question, which is, we've now got 50%, oh sorry, about 30% antibodies present in the recent study on children against SARS-CoV-2. Do we know what will happen if you give them a seasonal vaccine for flu, or if you give them a booster?
We don't know. I think we haven't even any evidence that it's a good thing to give someone who's had COVID a COVID vaccination. We certainly, in terms of children, if they've had COVID, there's no evidence at all to show that that would be a safe thing to do. And in terms of a seasonal flu vaccination, I'm not sure. Does one usually give seasonal flu vaccinations to children? Only the immunocompromised ones.
No, there in many countries, there's states, and I think in Canada, it's they give the nasal vaccination. It's quite widespread. And my concern when I was reading it is because it's not a dissimilar virus, whether or not you felt there would be a cross immunological response. I can't see anybody's raised it. And yet our government in the UK have suggested that in the autumn, we'll be having a top-up booster for any local variant that may creep up. Plus, I presume a nasal, I don't know, vaccine, which would include children.
I would be very concerned with further vaccinations on top of the COVID vaccinations in terms of, especially because we really don't know about antibody-dependent enhancement now, and also accumulation of all these the adjuvants in the vaccines. I don't know. They haven't really been very transparent about what goes alongside the gene. And the antigen producing component, but all of these vaccines actually have other component parts. So you've got the code that goes into the body and makes spike protein, but then it's in adjuvant. And I think we really need to get full disclosure from the pharma companies as to what these adjuvants are, and are they cumulative? So if you have 3 vaccinations in a year, for example, if there is a metal carrier in it, a lot of the vaccines have aluminium, or so if there is that, does it all accumulate? And is there a threshold where you shouldn't have more than so many vaccinations a year, or have these studies been done? And are the new vaccines different? They have different things in them compared to the flu vaccines and the vaccines before. So I really would like to know more about the vaccines, and I think everybody should be appraised of this.
And actually, should we not be checking everybody's antibody response to find out who has already had COVID and has antibodies or T cells? Surely there is no point in risking any of those patients with any other medical intervention. There's a lot of data that seems to be coming out now that shows reinfection rates in people that have been shown to have had COVID are much, much lower than reinfection rates in people that haven't had COVID but have been vaccinated. And as you would expect in general, the natural infection is going to provide deeper and wider immunity. So why do we risk vaccinating those people at all? Why is it even a question? Why wasn't that program carried out before the vaccines were ready?
There does seem to be a real silence in terms of, you would think because we're in a pandemic situation, a health emergency, that the government would be actively doing loads of research, so gathering people who've been vaccinated, gathering people who've had COVID, doing blood tests to see, are the people that post-vaccination, are they making spike proteins, a spike protein in their bloodstream, for example? What could be accounting for the symptoms of long COVID? What could be accounting for the clotting problems we're seeing on the databases, or the myocarditis, that we're seeing that seems to be happening in young people who get vaccinated. So there doesn't seem to be any active research or even follow-up, so with regard to all those, because on the UK yellow card database, we've got there's around 33 million people have received double vaccination in the UK, and there are 317,000 records. So it's 370,000 people have had reported adverse or side effects with the vaccine. And my question to the MHRA was, are they following up all those people? Because there's some very serious adverse events registered. And they have a way of looking at the background rate and then saying, this is just as many as we would be expecting, which is it's not really a good way, not a very scientific way of actually assessing whether one needs to be worried about those data or not. But the point is that everybody who's registered something has registered them because they're concerned that it might be related to the vaccine. And they need to be followed up because they might register a bad rash or something, but then in a month's time, it might have evolved into something else. more serious. Maybe it has a diagnosis of an autoimmune disease, but then because that person has already registered, they can't register again. So my question to the MHRA was, are you following up? And also I'd like to know what they're following up, because they must have had some expectation of the sorts, the nature of the adverse side effects they might see. And so they must have a list that they are following up people with those particular side effects, and then doing studies. But there's really no information and no transparency. And this is what's worrying. You'd think they would be updating us daily. So, this is what we're noticing this. If you have this particular side effect, do contact your GP. But we're not seeing any of that, which is concerning.
I think that's one of the things you highlight. I don't know what it is in Canada, but the yellow card system it's now electronic in this country, is actually a nightmare, because it's actually a positive action that someone's going to take. Mm. The way to actually find out in a scientific study whether anything is actually working is to assume something's gone wrong and then actually get a negative to say it hasn't gone wrong. With this, someone gets flus and chills and they don't feel very well. It happens over 24 hours. They're then better at 48 hours, so they can't be bothered ringing up. So those adverse responses are never recorded. Now, we have no idea, and I really do mean we have no idea of what the side effects of these vaccines are. What we do know is that people do have effects, but you have effects of every vaccine. But when you have the results on children, which are actually on 2,000, I think it was 2,200, the Pfizer vaccine study, over a very short period of time, with 1,000 in each group. When you have an incident of a rare complication, which is, let's say, 1 in 1,000, 1 in 4,000, in a short study like that, you're never going to pick it up. But in a country of 65 million, that's a lot of children a lot of young adults that will be affected. So you can't actually say this vaccine or any other vaccine is safe. And that's why routinely with our introduction of medicines, we actually have a minimum of 7 years follow-up. Now, these were all put through on emergency regulation, fine. It was felt that was what was needed. But now, with the situation in most countries in the world, in the Western world, we are not in that emergency situation. And we need to come back from that and say, no, hey, look, let's start from the position that we're in now. What do we do now? Look at the science correctly. Stop the political shenanigans. It's not a situation whereby there are the goodies and the baddies, the mask wearers and the non-mask wearers. It is a situation where we have to get the science correctly addressed and do it in a scientific method. And I think if that was done, the four of us here would all agree that we may be wrong. But at the moment, our concern, I think, is well judged.
You brought up the yellow card system. I'm really glad that you did. In the United States, there's evidence, cases of myocarditis in teenagers. And I know we don't have a lot of data regarding children, but is there a concern here? Can we somehow interpolate or extrapolate rather from the information that we have based on the yellow card data with teenagers, what effects might be produced in children? Is there concerning data there? Because I've looked at the yellow card system and it actually looks better than VAERS to me. Like you can list exactly what VAERS is hell. I mean, No,
I think, Sam, you're probably talking about the UK column where you can actually, you can list what you're looking for. Whereas, yes. And that's a private group.
Oh, is it?
So they've actually taken on the hassle of representing the yellow card data in a usable way, because the way the UK government represents it is just in these PDF documents, which are a nightmare to go through. So VAERS it puts it in an Excel spreadsheet, but the UK government puts it in a PDF, so you can't even extract those data or work with them.
Okay, so I stand corrected. Yeah. Thank you. So my question then, what kind of adverse effects are we seeing among teenagers in Britain? And what are the concerns there that we can?
Yeah, well, unfortunately, we don't have data by age. In the UK, the only thing they have is the adverse event. You don't get time from vaccination, you don't get the age, you don't get the gender. You're working in the dark here.
I had no idea. I'm so sorry. Okay, thanks for clearing that up.
So all we can do is look at the adverse events, and what we are seeing a lot of inflammation. So joint, arthralgias, myalgias, arthritis, and joint pains, which is arthralgia, muscle pains, a lot of pain generally as a symptom, which is worrying, especially, as a parent, you don't want to give your child something that's going to give them a pain, muscle pain, joint pain. Headaches are very, very common as symptoms. But then there's conditions. We're seeing a lot of the bleeding, clotting kind of condition, which is similar to COVID in a way, because, with COVID, part of the COVID problem is from the spike protein, which causes bleeding and clotting. So we're seeing that with vaccination as well. So obviously the most worrying and the things that are fatal are clots in the brain or in the heart, heart attack, or to the lungs with the thromboembolism. But a lot of, and a large number of the adverse drug reactions are neurological. So people with a variety of neurological events, from convulsions to tremors to Guillain-Barré syndrome. We have quite and that's also something I think that VAERS has detected. So we are also seeing Guillain-Barré. We're seeing myocarditis and pericarditis. We're seeing a lot of other autoimmune conditions, and there's a long string of them. And then obviously there's also the worrying, pregnancy and reproductive health conditions, which can also be related to perhaps the same pathology as the bleeding, clotting kind of pathology, with lots of women having heavy periods and lots of women who finish their periods, sort of postmenopausal women, suddenly starting to bleed again, So obviously people need to report and take, if they think that something that they've experienced is related to the vaccine, it's worth reporting, because only by reporting that we're ever going to have the data to go on. And doctors need to report. I know from my colleagues that they're so busy, so they might see 5 people who need to, and they just don't have the time to enter all those data, and then maybe they think someone else will do it, or the patient gets referred to hospital and they don't know what the final outcome is. So anyway, it's a mess. But certainly I think the database is all fairly consistent. What you're seeing on VAERS, we're seeing here, and it's being shown on the WHO database too, and European databases. I think it's fairly consistent.
But no age data.
Age data, no.
I just assumed that, and I was looking at that just the other day, but thank you for clarifying, Tess. Now, I want to be respectful of your time, gentlemen and lady, and you've been so gracious. John, I would like to ask you if you have any final message. And now that being said, we can definitely do this again, and I have a feeling we've just, we've the tip of the iceberg here. We've just, poked the tip of the iceberg. So, John, if you can address our viewers one more time, that would be great. And then Tony, and then I'd like to give Tess the last word.
The message really is one of, don't feel guilty if you feel that you don't want to vaccinate your child. You will get a lot of pressure of the governments, scientists, which say that your child will go to school, they'll transmit it, they'll get other variants, and hence it'll harm the me's, the grandparents of this world. Well, I think that as a scientist, as a doctor, some almost 50 years now, that I feel that there is no evidence to suggest that your child under the age of 16, in fact, probably under the age of 18, needs to be vaccinated, and certainly not vaccinated for me. And so the science is something which is still open to interpretation. There's no black and white, but the one thing there certainly is a need for a mandate to vaccinate children.
Thank you, Tony.
I would say there is some good news from the UK. We have the decision of the JCVI, which does at least mean that most under 18-year-olds are not having mandated vaccinations in any way. I think there's more good news on that, because that also makes it more difficult to institute COVID passport, because that means that young people are another group of people that cannot have a COVID passport, along with a lot of ethnic minorities and people with various medical conditions that mean that they can't be vaccinated. And I think there's more and more discussion in the UK on mainstream media of these sort of topics, even compared to what we were getting 2 months ago. Even on Radio 4 last Friday afternoon, there was a discussion about ivermectin. And if we're not allowed to discuss these things, we will never come to the best decisions. So I think there are some positives that are starting to come along.
Thank you, Tony. But we just had World Ivermectin Day a few days ago,
yes.
And it went by here without a sound, you know. So there's a long way to go. And just recently, the U.S. Justice Department said that it's not, their opinion piece was that it's not illegal to mandate vaccines for the public and private industry. So we have that issue. And then we have Biden saying that it's a pandemic of the unvaccinated. And then he just came out with that a couple of days ago too. So, you know, there's certainly a long way to go. Tess, could you please wrap this up for us?
Yeah, I think it's important for parents to know that COVID is treatable. People who are vaccinated still get COVID. They're still getting COVID because the vaccines don't seem to work very well, and they don't work against variants. If you get COVID, whether you've been vaccinated or not, ivermectin in combination with other treatments will help and will protect you from getting bad COVID and protect you from getting into hospital. And so my message to parents is to wait for safety data and trust your intuition that you know best for your child, and take back your responsibility and your parenting responsibility and protect them from disinformation as much as you can, and protect them from any interventions you think might be harmful, because if they might be harmful, just not worth the risk.
Tess, are there any web resources that people can turn to? You're speaking about that. If you could, like,
yes. So what I would do is I would look at two resources. You can go to the bird-group.org website, and there you will find a lot of information about ivermectin, which is a safe old medicine that can be used in combination with other therapies. There's lots of different treatment protocols and guidance that you can take to your doctor if one of your kids gets sick, and say, this is how you can treat COVID, and if they don't know, okay, because there are lots of doctors who don't know. So you've got to actually educate your doctor in this instance, perhaps. The other website, which I find incredibly useful, if I'm ever in any doubt, or if I want to look up, my neighbor has a heart attack after his vaccination, and I want to just check whether this is a thing or is a concern, then there's a website called ukcolumn.org, and they've got a yellow card section. You click on that, and they update those data weekly. So you can get an idea of how many people have actually reported adverse events. You can type in stroke and see how many strokes have been registered so far. And although we know that this isn't a causal thing, you can't say that, you know, the vaccine caused that. It is an early warning system to say that these are the sorts of side effects that are being reported. And I think if you keep abreast of that, you will be empowering yourself with the information you need to make healthy choices for you and your family.
Wonderful. Thank you so much, Tess. So with that, I would like to adjourn and just say, would love to do this again. There's a lot more to discuss, but on behalf of myself, Dr. Sam Dubé, I would like to thank Dr. John Feickler, Dr. Anthony Hinton, and of course, Dr. Teresa Tess Laurie for expressing their views here today. Very valuable, important, and urgent messages and information for our viewers, not only in Britain, but beyond. So with that, don't go anywhere, doctors. Please stay there. I just want to speak with you for a moment, but I want to thank you again, and Godspeed to you.
Thank you, Sam.
Thank you very much.
Thank you, Sam.